Alright, so now that that's the basic of blood vessels, let's talk about some more specific ones. So the biggest artery in the body comes out of the heart. It's called the aorta. The aorta leaves in an arch and it travels down the chest and into the abdomen. And that part is called the descending aorta. At that arch, it splits into two subclavian arteries, both of which bring blood to the arms. Other arteries will branch off of your aorta and then head to various organs until the aorta finally splits in your pelvis to your two iliac arteries, where they head down and supply the legs with blood. So coming back up, your venules will turn into veins. Then the veins will begin to feed into one large vein called the vena cava. Your inferior vena cava will bring the blood from the lower parts of your body up to your heart, while your superior vena cava will bring the blood from your arms and your skull back down. Alright, so some more specific vessels. Starting at the top, inside your brain, there's a circle of arteries called the circle of Willis, and it brings oxygen to all parts of your brain. It's actually really clever. The circle acts as kind of like a safety mechanism. If one part of the circle gets occluded, say from a blood clot or from a piece of fat, the whole brain won't be affected because the blood can just go around it. It's pretty nifty. Moving back to the chest, we have our pulmonary vessels, which I've talked about in another video. It can get tricky to remember which one's the pulmonary vein and which one's the pulmonary artery. Just remember that the definition of an artery is that it carries blood away from the heart. The expectation I have is that you guys can label all parts of the heart and the pulmonary circulation in order. So take a drop of blood, trace it from the inferior vena cava, run it all the way through the heart, through the lungs, back through the heart, and out the aorta. Coronary vessels are the vessels that feed the heart or give the heart oxygen. They start in the aorta, just above the aortic semilunar valve. When the left ventricle relaxes, or in diastole, any blood that's left inside the aorta is going to flow back into the coronary arteries to try and feed the heart muscle. If we get fat blockages, so arterial sclerosis, or hardening of your arteries, atherosclerosis, or we get a blood clot and it gets lodged in one of those coronary arteries, that's what we call a heart attack. So you'd end up with shortness of breath, tightness in your chest, maybe pain in your arm as well. We need to get them to a hospital and we need to start getting them treated quickly. All right, moving down from the chest, we're going to start looking at the digestive system. So all of the organs in the digestive system, specifically the stomach, small intestine, large intestine, and the spleen, have veins that travel directly to the liver. These are called the hepatic portal veins, and the idea is the blood will absorb the nutrients from the food we've eaten and then take that blood and head to the liver, where it's filtered out and metabolized and broken down. This is to make sure that if we've taken any toxins, we don't poison ourselves accidentally. From the liver, the blood travels to the hepatic vein and then to the inferior vena cava. Lastly, we have the fetal circulation. All right, so this one's a little tricky. So babies in the womb share their blood supply with their mothers, and this all starts at what's called the placenta. The placenta is this big mass of tissue, and it connects to the wall of the mother's uterus, and it acts as a filter for the baby. So the baby or the fetus will receive nutrients and oxygenated blood from mom, but it also makes sure that no toxins or bacteria or anything gets to the baby that was in mom's blood. So after the placenta, we have this umbilical cord, and this is going to connect placenta and baby. The umbilical cord is made of two umbilical arteries and one umbilical vein. The umbilical vein carries blood from the placenta back to the fetus. So we started the placenta, now we're in the umbilical vein. The umbilical vein carries the blood that has oxygen in it, and it's going to bring it right to the baby's vena cava. So it does this by going into the baby's liver and joining at what's called the ductus venosus. From there, the vena cava heads back to the heart, just like in an adult. All right, so recapping again, we're a drop of blood. We're in mom's body, we're heading to the baby. We travel through the placenta, into the umbilical vein. We go to the ductus venosus, and then into the vena cava. Now we're floating up to the heart. So the heart of a newborn is a little different. First of all, the lungs don't actually work yet because they're filled with amniotic fluid. So to take away some of the strain, there's a structure in the heart called the foramen ovale, which allows blood to go from the right side or the right atrium into the left and just skip that whole pulmonary circulation altogether. Lastly, we have a ductus arteriosus, which takes any of the blood that did make it into the lungs and divert it right to the aorta. So again, both of these structures allow blood to skip the fetus's lungs until after they're born. Once the baby's born, those two extra pathways will close off. So one more recap: placenta, umbilical cord, specifically the umbilical vein. Then it goes to the ductus venosus, vena cava, and you can follow it in through the heart. Inside the heart, we get our foraminal valley and then our ductus arteriosus.